Hello. Hi, a very good afternoon to everyone. My name is Johannah and I'm a community pharmacist working in Watsons. On this segment, Ask Our Pharmacist, I'm here to discuss about a health topic that was voted upon by all of you when we released a poll on Facebook and Instagram. The topic with the most votes was acne. So if you have any questions along the way, do feel free to leave them as comments and we'll be getting back to them at the end of the sharing. Okay. So to start off by introducing acne, a majority of us may have experienced acne problems during our teenage days. In fact, research has shown that 85% of young people between 12 to 24 years old have acne. During this pandemic, some of us may have this problem coming back or worsen, which may be a result of stress or wearing a face mask for long hours. So while acne occurs mainly on the face, it can also involve the neck, the shoulder, the chest, and the back. They can appear as whiteheads, blackheads, red swollen bumps or pus-filled lumps. So acne is mainly caused by 5 reasons: excessive oil production of the skin, clogging of skin pores by hair cells or dead skin, bacteria which is called Propionibacterium acnes, excessive hormonal activities and inflammation of the skin. So some of risk factor of acne includes stress, hormonal changes in the body, and exposure to certain irritants in cosmetic products, especially the more oily ones. Certain medications like oral corticosteroids and constant friction and irritation to the skin, such as prolonged use of face masks or headgear, can cause or worsen acne. So in most cases, acne is not life-threatening, but it can cause scarring of skin, leading to emotional and psychological distress. Hence, it is best to start treatment early in order to lower the risk of such problems. So, as acne is mostly related to skin hygiene, it is very important that we take good care of it. There are a few acne prevention and self-care tips that I would like to share with all of you. So firstly, wash your face not more than 2 times a day using a gentle non-soap facial wash with warm water. You can look out for facial products that are labeled as non-comedogenic or oil-free. The formulation of these products are less likely to cause acne. Avoid scrubbing or washing your face excessively, as it may damage the skin surface and worsen the condition. And also, wash your face after every episode of exercising and sweating. So avoid touching your face as much as possible, as your hands come into contact a wide range of bacteria over the day. So for individuals who need to wear a surgical or reusable face mask for a long period of time, ensure that you change your mask timely or wash your reusable mask frequently. Some people may observe that their forehead tends to have acne breakout when their hair is oily or they have fringes. Can consider a hairband or tying up your hair, and also daily shampooing of hair can also lessen the transfer of oil onto the face. For acne that is occurring on the body, wearing loose-fitting clothing may help, as tight clothes may trap heat and moisture, which can irritate the skin on the neck, the shoulder, and the back, resulting in acne eruptions. So avoid heavy foundation makeup, as oily makeup can cause clogging of pores and worsen acne. If you need to apply makeup, do remember to remove the makeup entirely and wash your face thoroughly before going to bed. If you realize that stress worsen an acne outbreak, do find way to manage and relieve stressful periods. There are some pretty good tips shared by our pharmacist, Colleen, through our Facebook Live session on 8th of May on the health topic stress. And last but not least, pricking and squeezing of zits is one of the pitfalls in most people. Although it's very tempting to squeeze and prick acne, do not do so as it may cause infection and skin scarring. So in terms of treatment, there are a few acne medications that you can get off the shelf or from the pharmacist. They target different causes of acne. For individuals with oily skin, lotion or gel formulation may be more suitable as they have additional drying effect. So some of the over-the-counter medications are benzoyl peroxide and sulfur-containing products. They work by slowing the growth of acne-causing bacteria. And if you are looking for more natural options, you can consider tea tree oil for their antibacterial and anti-inflammatory properties. As for pharmacy-only medications that you will have to get from the pharmacist, they are adapalene, azelaic acid, and clindamycin. So adapalene and azelaic acid are medications that are form of vitamin A. They help to reduce the dead skin layer, the unclogged pores, and also reduce oiliness. And in fact, adapalene can be used on a daily basis for prevention and treatment of acne breakout. As for clindamycin, it is an antibiotic that kills the acne-causing bacteria. This medication can only be used when there's an acne breakout in order to prevent the development of bacterial resistance from excessive use. However, if you use clindamycin, it's also encouraged to be used together with benzoyl peroxide to slow down the progression of bacterial resistance. So if an acne treatment is working for you, you should see improvement in 4 to 6 week time. Avoid changing acne medication too often as it may irritate the skin and worsen the condition. Do talk to your pharmacist or doctor on which medication is the most suitable for you and how to use it to get the best effect and minimal side effects. Do let them know if you have any drug allergies, any long-term medication, or any medical condition. So there are some situations that it's better to consider visiting a doctor, such as if your acne is very widespread beyond the face area, or they present in very big swollen bumps or pus filled lumps. You may also consider seeking medical attention for stronger medications if your acne problem is very severe and it affects your appearance. If you have started on a new medication and you realize that you have new acne outbreaks, do discuss with your doctor at the next follow-up to see whether is the medication the cause of the new acne outbreak. So this is the end of my sharing, and we will see whether we have any questions. Okay, Okay, so one of the very common question or inquiries that people ask is whether does food actually trigger acne. So there are studies to show that actually dairy products or high glycemic food will is associated or cause acne problems. So dairy products are such as like butter, cheese and milk products, whereas high glycemic food is actually food that will increase the blood sugar in a very short period of time. So people with acne problems may consider reducing the intake of this food, and there's a myth that's saying that oily food and chocolate actually cause acne outbreak. So there are studies that shows that, or there are not really a lot of studies to show the association between oily food and chocolate with acne outbreak. So this is a myth to debunk, but for some individuals there are some food triggers for them. So if you realize that food is highly related to your acne problem, you may consider avoiding it regardless of whether is it dairy product or it's oily food. So there's another thing is there any supplement for acne? So most complementary medicines for acne are those that is to be applied on the skin, the topical ones such as aloe vera, alpha hydroxy acid or tea tree oil. So in terms of oral supplements, there are some studies to suggest that zinc supplements or probiotic may help, but the studies for these supplements are not very robust yet. So there are lack of evidence to show that they are effective in acne conditions. So we should wait for more evidence to actually support the effectiveness of these supplements in acne condition. And let's see. Okay, so another concern with acne problems are scarring. So if the acne problem is very bad, there are two types of acne scar. One is the sunken in ones, which is called atrophic scar, and the other one is the raised one, which is called hypertrophic scars. For the atrophic scars, for now most treatments are procedure related, for example surgical injection, filling injections or lasers. So about this, you may want to consider seeking a dermatologist's opinion and see whether how to go about it. As for hypertrophic scars, other than procedure, there are some evidence to show that silicone gel therapy may help, as it can help to flatten and fade away the scars. So these are some products that may be get off the shelf, and you may want to consult a pharmacist before starting on this treatment. So yeah, and that's the end of today's session. Wait, okay. We may have some technical issues looking at the comments and questions. Do not worry, you can continue to leave your questions as comments, and I'll be getting back to them after the session. Yeah, so if you have any more, you can continue leaving them, and that's the end of today's session. Hopefully this is helpful for you, and if you have any further questions about acne, you can drop by at the pharmacy to ask the pharmacist. And look out for the next poll, and we'll see you again next time. Stay safe.